how has it been working in the community in the city?
I love it. So being in the city, obviously there's a lot more patients than you'd probably find in a county. It's an ageing population, so majority of our patients are elderly who can't get to a clinic, which is unfortunate, but that's our job. I love it though. My colleagues are amazing, the management team are so supportive, and I love spending time with the patients.
And what kind of patients do you have?
So we have a variety of patients. I have patients that are quite self-caring, but they just need support with, say, insulin administration. I have palliative patients, patients that have leg ulcers that can't get to a clinic. We have quite complex patients that have a variety of needs that have input from physios and OTs, myself, probably specialist nurses as well. We do obviously have some young patients as well that can't get to clinic. Have a variety of patients that are having long-term treatment, so chemotherapy as well. Yeah, we have a wide range of patients. The reason I joined this job is because I love doing holistic assessments. So if I go to a new patient, I'm not just considering the whole in the person, I'm considering the person as a whole. So I'll think about their environment, are they safe? Do they need any equipment? Obviously I consider the reason that they've been referred to as say if it's a wound, how have they got that wound? I'll be dressing it, I need to refer them to specialist services, so there's podiatries, we've got tissue viability nurses, there's vascular team, we've got the GPs, and then I've got other things to consider, so how am I going to treat that patient? What's most appropriate? I use my knowledge, look into evidence. I can also we've got a complex care nurse, so I can talk to them, get more advice. So yeah, it's basically I feel like I'm making such a difference because I'm using my knowledge, what I learned as a student, and I'm applying it to that patient, and that patient is quite thankful. You build such a relationship with them and their family, and they're so grateful, and I love it because I can go home thinking I've actually made a difference, and I love going to work.
So I was going to ask you, what's it like when a patient gets better because of things that you've done?
Yeah, it is. I mean, there are patients that, say if I see a patient 3 times a week, every week for 6 months, you build a relationship with them, and then you are sad to see them go because you spend that time with them, like they know a lot about you and you know a lot about them, but then you're obviously happy for them that they are healed and you've made that difference. That's all down to you, it's nobody else. So
what would you say to someone who's considering their nursing options, perhaps they've just qualified, and they've seen a vacancy working with the city community nursing teams?
I would definitely take it. When I was a student, I was advised not to go for district nursing. I was told, oh, district nursing is something you do when you get older, when you settle down and have kids, because it's more relaxed. It's not like that. I found that I've learnt so much in the past year that I've been here than I would have learnt anywhere else. I've developed so many skills. If I want to go on an extra course, I can. My management team are pushing me to do continuing professional development. They want me to progress throughout my role. And I just love it. I love getting up in the morning and going to work, and I can't say that about any other job I've ever worked. I definitely would recommend this to anybody, 100%.
Okay, thank you very much.
Thank you.